This conference will now be recorded.
Welcome, everyone. My name is Lynette Tolson, and I am the Executive Director of the North Carolina PACE Association. As a reminder, this call is being recorded. This webinar and its recording is for general informational purposes only and does not constitute business or legal advice by the North Carolina PACE Association or any of its participating members. I hope that by sharing this notice with you, you will feel free to openly participate in today's call. Before we get started, I'll briefly review how to participate in today's webinar. Your audio participation is essential to today's call. In order to reduce background noise and ensure that all parties can be heard, I'm going to ask that everyone take a moment right now to locate the mute control on your device. If you're using a cell phone, you may need to hide the dial pad to locate the mute control on your smartphone screen. If you're using your computer's audio today, a mute control is available on your GoToWebinar control panel. Please mute your line now. Thank you for muting your line. Please remain muted until you're ready to share. When you're ready to share, take your own device off mute. Provide your name, your program name, and share your comment or question. After you have shared, please return your phone to mute. In addition to muting your line, I ask that you do not place your line on hold at any point during today's call. Lines placed on hold will transfer your organization's hold music to our webinar and will be removed immediately. If you happen to get disconnected from the webinar, you will be able to reconnect with us by following the same steps you took to call in. I'm here if you need assistance at any time with today's call. You may reach me through the chat pane in your GoToWebinar control panel or by email at Lynette, that's L-Y-N-E-T-T-E, at ncpace.org. Again, thank you everyone for joining us today, and I'd like to introduce you to our presenter, Rosita Wong. Rosita is CEO of HealthJ. HealthJ is a virtual programming platform that is designed for PACE. Its 4 pillars of features are case coordination, activities, social engagement, medical health management, and remote meals and services verification. They allow PACE communities to leverage virtual programming for member sustainability and hybrid PACE transition and future market growth. Rosita will share with us today her experience and best practices with virtual programming and help us to enhance our preparation for a major shift in our industry. And now I will turn things over to Rosita. Welcome, Rosita.
Thank you, and thank you, Lynette, and good afternoon to all of you. Good morning to me. I'm based in California. It's such a pleasure to be here with all of you today virtually, and it is a really good step for us to build senses, to build solidarity during this difficult time in our industry. My name is Rosita. I'm the CEO of HealthJ. Today, I have the privilege to share with you some of my experiences in terms of building the infrastructure for virtual programming. What do we need when we move into telehealth or a future hybrid delivery model for PACE? Maybe we can go to the next slide, Lynette, please. So when it comes to virtual programming, it is actually a broader sense than just telehealth. And what are we looking for, right? What is the benefit? What are we going to benefit as a PACE community from virtual programming? This is becoming the buzzword for our industry. So there are a few things that we can look at. Number one is remote participant engagement, right? Folks are now staying at home, they're not coming into the center, they're not coming into your facility. How are we going to really deliver our services from far away? All of us have a component of adult day programming during the daytime. How are we even getting folks to be active, to be engaging, to be socializing with the friends that they used to meet and see in your adult day classrooms, right? Then we're looking at remote patient monitoring. because medical support is such a big piece of PACE. How are we going to integrate medical devices, medicine management, things like that from far? I know that a lot of our PACE communities have been doing that already by remote phone calls or some telehealth, but how are we going to make that into a systematic operational system that we can really take it on as the next phase when we go into hybrid? Then we have telehealth appointments. Yes, we are doing maybe iPad, maybe other devices through, to engage in telehealth appointments. But what's the sustainability? What is the engine? What is the activity engine that we're going to use to manage all these appointments? When we are doing 1 or 2 per day per member, well, it's still manageable. But how if we're going to be looking at the full program, the full appointment scheduling per member, 150, 200 at one time? How are we going to manage that, right? So we're going to explore all this today. And then, of course, we mentioned about meal deliveries. A lot of us, we used to provide lunch, breakfast, and things like that on site. Now, if it's remote, how are we going to validate that fact that we did actually deliver those services remotely? Last but not least, we're going to look at remote IDT coordination, and that's a core piece of what differentiate PACE from other communities. It's how we're going to have 11 different professionals communicating on virtual platforms and how we're going to streamline those communications. These are actually benefits that we can look into when it comes to virtual programmings. May I go to the next slide, please? So factors to consider. These are the questions to ask when it comes to vetting or selecting a virtual programming platform. What comes to mind? What should we be taking note of, right? Number one question is, what kind of model that you plan to migrate to? Are we going to stay just purely center-based on site? Or are you going to start doing some kind of an intermediate step of, going from a center to having some sort of a virtual programs, but not full blown? Or you're going to be really migrating into a model of hybrid. It's going to be 2 days at home, 3 days in center, or mix and match of 1 day, 4 day, so on and so forth. So this is about having a model that will be institutionalized internally, and that's something that you really need to consider. What is that going to look like? That will then affect how we're going to deliver services. So health appointments, medicines, devices, and activity programs, appointments like telehealth, social interactions. Is that going to is that going to allow your members to make phone calls? And what about the fact that sometimes they may need some urgent help? How are they going to be able to get to the caregivers instantly when they're staying at home? Meals and snacks, right? Remote services. Yes, we are doing that. What about drivers? What about staff? What about how are we going to integrate that delivery into your back-end system that currently EMR does not record those things, right? And then transportation. When it comes to members that are in rural areas, it's very, very challenging in the past to arrange transportation and get them into the center. Now, with virtual programming, bingo, it's now becoming an opportunity. With virtual programming, you're able to have new revenues and new market by reaching out to folks who are far away with no transportation or barely having any transportation. Because now they will be just like any other regular members. You can connect them through a device to your network. And then when we look at, and this question actually come across to me all the time, folks are saying, well, my members are really hardly using any device. And so they don't like technology. It's really hard on them. So we're looking at digital capability. And I just want to bring up a point here is digital capability is actually 2 levels. Level number 1 is, yes, we need to engage the member. We need to have a super simple design that does not discourage them or causing any user fatigue down the road. And that is not just technology-wise, it's also language. Do we have Spanish? Do we have Chinese? Do we have Arabic? Because virtual programming, again, is very different from EMR that we are used to run, at the center. EMR is, as long as our care team able to communicate, use it in English language, and manage those navigations, smooth sailing. But when it comes to virtual programming, it's a personal device, it's a personal experience. It got to be language, having language capability. It got to be very much user friendly. It got to fit cognitive level of your elderlies. And so digital capability level 1 is that really be flexible enough to meet the needs of your member. Level number 2 is caregivers. Yes, caregivers are a lot more tech savvy than your members, and they're tend to be younger and having digital devices in the last 10 years. But at the same time, caregivers are overwhelmed with now 3 hours of disinfecting the building, 3 times per day, and getting all these new dry run to deliver meals and things like that. We are taking on new responsibilities. And so when it comes to digital capability, is the new system, the virtual programming system, be able to streamline conventional tasks that your caregivers are taking on? Is it going to help them? Or is it going to giving them 300 different features and overwhelm them, right? So that's something that we need to really think through. And then it's end user connectivity, especially in some rural areas. We are seeing a lot of members not having Wi-Fi at home. So when it comes to virtual programming, we need to make sure that there's data plan. The device that you choose will have a SIM card that can plug in and be able to use data plan or hotspot. Some rural areas, some carriers are better, some are not as good as providing very reliable connectivity. So we need to make sure that all this is like the infrastructure, the foundation of even considering virtual programming. And then we need to look at it as a short-term goal versus a long-term plan. Short-term is, a lot of you may already be doing that, is that we got to get a COVID Care Act grant and get 20 iPad or something like that to the center and start using that for telehealth, and they can pass along whoever is next in turn, whoever is next in line to use that iPad. So that's the short-term fixes, for lack of a better word. But so we can engage in some wellness check, maybe some basic programming, some telehealth, some telehealth monitoring, things like that. But when it comes to long-term planning, the question then is, are we going to have 10 or 20 different devices? Are we going to have 11 different professionals in the IDT team talking offline, still using paper, doing a lot of paperwork, when some members already migrate to virtual? How are we going to sync up all of these into our hybrid program? Even as simple as your daily activity program director, right? It used to be in center, so 30 members will be doing Zumba together, and now it will be 30 of them doing at home, maybe 15 at home, 15 in the center. So what are the creative program content that we are going to customize as we move forward? May I go to the next slide, please? So that's beyond what I just mentioned. There are some of the key things we also cannot forget. Number one is device. We are seeing different device. There's different tablet. There's different. Some folks using use their cell phone to go online, to use Zoom and all that. I just want to mention that there are different devices out there. Some of the devices are smaller screens, some are bigger. A lot of them don't come with a stand. So if you are trying to do virtual programming from home, it would be a lot more ideal if your member will have a stand that can put the tablet on the countertop or something like that. And then the cost is another factor, right? If you get a grant for $5,000, how much can we get? 10 or 20 tablet or something like that. So we gotta kind of look at the budget as well as we go forward. But the devices are not locked down. So what we have in the industry is something called the DMD, the mobile device management, which is actually kind of like a back end system that can lock down the device. So when your member using it at home, they are not going to go to Amazon and start shopping and using their credit card for things, or so that is something that we actually promote a lot these days. Is when it comes to telehealth, when it comes to conducting activities for elderlies, we need to protect them and watch out for them. So we most of the cases will apply DMD, mobile device management, that can lock down the app or the system so that they don't go outside and do other things that is out of our control. Then product functionalities, we need to look at what kind of a system that you are considering, and does that meet your short-term goals and long-term goals? And we're going to go through that in a short while. And then training and support. A lot of us, most of the time, when we think about training and support or IT support, we think of technology. But from my perspective, I think it's actually very personal. I think that having technology to be matching with seniors is actually a customer care more than just technology support. Number one is that the company that you choose, or the device or the system that you sign up with, should have the flexibility of matching the needs or the evolving needs of your members. Because we all know day one, Mr. Johnson start having dementia, in a year or two, his cognitive level will change drastically. And so health conditions evolve, and how they work and interact with technology is changing day by day. If we are selecting a system that is rigid or cookie cutter and say one size fits all, and here you go, give me $3,000 a month and I'll give you all this device and a system, that is not going to, I'm not going to say it's not going to work, but it's going to have a lot more challenges for you as an administrator or as a member of the care team. You're going to see that your member are going to be using it in the beginning and then start having more and more fatigue as their cognitive level changes or as their health condition changes. So when you select a company to work with, it's not just to buy a technology off the shelf. It's really to select the people. It's to select a team that can work with you, that can listen to you and feel and understand and care about the people that you care for. And then integration. It's a system that you want to choose an open platform, right? Ask them the question, is an open platform, is that going to integrate with my EMR system? Is that going to be integrated with my blood sugar device, my blood pressure device, my fall detection device, my elopement device? Is that going to be, having all these devices in a separate portal that my caregiver or my staff will have to open 10 different window on the desktop and manage them separately? Or you can integrate and sync them all, and it's one portal, and we can just learn that one portal and integrate everything at ease, right? That's the question of integration. And then scalability. That's something that I think is practical. A lot of the people, a lot of centers that I see these days is that they will usually start with a smaller scale, let's say 40, 50 device, and pick the most tech savvy members to start and try it out. By doing so, you are giving your care team, your staff team, a chance to really practice it, right? So the RN will be able to do wellness check and kind of run it through and see, what are the glitches here and there. And then as we scale it up, most of the time it's about 2-3 months, and get a hang of the system, and then they will scale it up to the entire PACE community. And so that usually is the step 2. And then the step 3 is new membership. As I mentioned, there are members who are not belonging to any services, who are in a rural area, who does not have transportation. They're actually new membership that we can recruit. And so when we say scale it up, that is for new market. By using virtual programming, we can bring them on as to your as a part of your family, and by doing that, that's a scale up that was not possible before. Now it is possible through a virtual programming platform. And then it's a budget, right? And so it's budget. So when it comes to budget, we need to look at usually there are systems out there that will be able to offer you device, software, a backend software, and networking and things like that. And there are products out there that more so that you have to do it yourself, like DIY, like you have to buy the device on your own and then match that with the system, and then a software and things like that. So those tend to be more costly. If it's kind of like all in one, it comes with one package. There's a lot of savings in between, and also it's easier. I mean, it's also the human cost that we're gonna invest in learning, and that is a cost that you'll be saving in the future. So not just looking at the price tag or monthly cost, but also the cost that you'll be saving down the road when it comes to execution. Next slide, please. So product functionalities, and I just barely mentioned that. I would like to keep, kind of deep dive into it. Basically, when it comes to product functionality, the question is, can you get it right from the start, right? Can you get the right system for you from the get-go, so then you don't have to swap to another system? I did have experience with a center here in the Bay Area in California. They were using another system, and then it was just too difficult to navigate, and then their staff was spending 3 hours hand holding and just teaching how to do, how to take the link and then go on to a telehealth appointment. And that becomes too frustrating and too time costly, and it's not effective. So, we were talking to them, and it became a migration to my system later on. But I mean, my point is we need to make sure that what they offer is what you need today, but not just today, but also for tomorrow. Video conferencing, is that easy to join? That's the bread and butter. That's the basic bottom line. Why we're doing virtual programming is to have the face-to-face time, right? If you can't even make your member join the meeting without any barrier. I mean, if I have a stroke, if I'm not physically able to move that much, well, I can't tap the link. Yeah. If I have dementia, I cannot tell join or not join, or green or red. Well, how can I participate in my telehealth meeting, right? So go look for, and there are out there system that had built-in virtual conferencing functionality that has 0 barrier for members to join and does not discourage them, and for all the key things that you need to do as a PACE community every single day, like wellness check, telehealth appointments, medicine administration, all those key things must happen. There won't be any barrier. They will show up and then be in front of the RN and talking and being diagnosed, So that's important to know. Zoom is not the only option. There are plenty of them. There's FaceTime, but they all need to have multiple steps. There are things and apps and product out there that doesn't have those barriers. Specialized platforms. Again, we are looking at not just having tablet or devices that doesn't integrate with caregivers. So when you look at platforms out there, they need to engage caregivers, but also partners. one big piece about PACE is that we have so many partners. We have medical partners, we have social partners, social work partners, drivers, and there's different roles in the IDT team. How are we going to engage them? Is that virtual programming platform only about that last piece about video conferencing, or it is also about engaging your team on site and off site? Then a step further, are we engaging a higher level, all those multiple partners, right? So this is something that's beyond what we are so used to, beyond EMR, EHR. So cognitive customization. Are we able to evolve, as I mentioned, as the cognitive level changes, and you have different members? Different members have different starting point, and how they change, how they evolve. Is the system able to customize to that? Is there any enabling and disabling features that you can turn on and turn off? If Mr. Johnson is doing great today, well, he can do maybe 10 features. Maybe if he's not doing that great, he can only do 2 or 3. Maybe sadly, maybe one day he only can do 1, right? And so we need to look for those things. Text to voice, right? Also helpful. Accessibility, auto join feature, auto join to video conferences. So those are really related to memory care, cognitivity. Then we need to look at EVV. EVV is more so of a home care functionality, but with us delivering meals these days, they used to come to the center and have meals. But now if we are delivering those meals to their home, we are checking them out, doing wellness check on the porch. We need to make sure that all those are documented in our report. So, does the system have integrated EVV, or what we call the MVV, mobile visit validation? Scheduling, are we able to be sustainable when it comes to scheduling? Now, when you used to see your members in the center, they all come, and then you say, well, you guys can sign up for this yoga class 1 o'clock tomorrow, and 50 of them will just sign on the paper, and all good, all done, right? Now you're going to make 50 phone calls, calling them to their house. Is that sustainable? Is there any mechanism you can look into in a virtual programming platform that can do the job for you at ease, without all this paperwork, without these enormous phone calls? There are device and software built in that has scheduling engine in there. Health monitoring interventions. When they're staying at home, is there any way that can monitor them, and remote patient monitoring, as I mentioned, integrate those devices? At the same time, how if they fall? How if they fall and trip and they need help? Doing those, they used to spend time in the center, you see them, if they need anything, you will be able to come right away and take care of the incident. But if they're at home, is there any first response system that can be handled among the PACE team without calling 911, without having the cost on ambulance or ER visit or hospitalization, right? So again, there are systems out there that has those functionalities and that is integrated into the software. And then I think that we need to just kind of think through it, right? They are not in the center at home when all those incidents happen. How are we going to handle that? And that's part of the question, actually, as we move to hybrid delivery. If there are 3 days at home, those scenarios will come up. And so I think we should kind of think through those scenarios and look into the product functionalities and see if that's available. Program activities, enrollment, invitation, make it easy, make it simple. Don't overwhelm the caregiver team. They cannot be doing all this new task post-COVID or during COVID at the same time, calling again 50 people just to invite them to a birthday party. See if there's any way to have activities, virtual or even in center, managed in a way that is not causing a whole lot of effort from your daily operation. With virtual programming, we actually able to engage facilitators for activities like translators, right? Translators back into before COVID, right? We need to have a booking with a Spanish translator to go to the clinic with Mr. Johnson, my member, and my staff would drive or take the member there. So it's 3 people. Now with virtual programming, you can easily invite the translator anytime, and then the patient, and then maybe a son or a daughter of the patient, and then your care staff, and then the doctor. So it's a lot easier. Virtual programming actually does save cost and does lower our daily operational cost. And so we need to kind of take that cost saving and think, well, we have a lot more expenses in other areas, like really, the PPE and things like that. So how are we gonna kind of balance the book? I mean, I believe that virtual programming, it's really the cost saver that can help to leverage, other increase in expenses in other area. And so IDT coordination, so we have a platform integrated in the virtual programming platform that can make sure that the left hand knows what the right hand is doing. The social worker is knowing that, well, the patient is got dropped off now and is moving towards HUD housing or something like that. So I want to make sure that everybody is seeing what we are doing on the same page. And now they may be meeting each other, the team may be meeting each other, talking about a health plan and things like that. But when we don't even be in the center, how are we going to get onto the same page, right? Is there any file sharing mechanism there? Is there any, text messaging function built into the virtual programming platform that can enhance the communication among these coordinators? Then it's about data tracking and report. Are we getting the data? Are we tracking every hours that your member are using your classes, or tracking all those hours they spend on telehealth appointments? Are they missing any telehealth appointments? Now, if let's say if Mr. Johnson is missing 10 out of the 15 telehealth appointments in the last week, well, then that analytics is telling you that he may be having some challenges in his health condition, right? So the data capturing is very important. So look for a system that actually capture those data for you. Unfortunately, just an iPad will not do the job. They don't capture the data and share with you. And hey, here's information. Here's a weekly tracking. There are software out there that can help track, document, report, and integrate it with the device. Then we're looking at management oversight, right? So there's health components, social interactivity, case management, meals, transportation. That will be a wonderful system if we can house all of these under one umbrella. Now we have security features, HIPAA. Not everybody has HIPAA. In fact, it is not a requirement for telehealth to have HIPAA during this time. Zoom doesn't have HIPAA. iPad doesn't have HIPAA. So look for a system down the road if you really think of migrating into a hybrid model. HIPAA is very important for us to carry our medical appointments. Security, is there any password protection? If you lost a device, what to do? Is there any way to recover the device? Is there any GPS locator within that device that help you to recover it? And I mentioned about the mobile device management early on that help you to screen off all the spam calls, all the telemarketer phone calls, because you could log the application without any other people can come in. So next slide, please. So thinking outside of the box, that's important. That's what we are all doing here, is to put our heads together and think of what to do to bridge the hybrid gap. Now, we are now doing a lot of remote services, but when folks are coming back to the center, let's say 3 days here, 3 days there, what are we gonna do? Is there any mechanism that can sync the home activity that going to go through probably a tablet or something like that to a center's in-person, in-person activity? In my world, I mean, we did a lot of things that with a code. So let's say QR code. We try to sync, and basically we assign a member with a QR code and then scan them in, scan them out, check them in, check them out. So either they're at home, they will log on the device, and they have a code built into the device. And then when they come into the center, we're giving them like a bracelet, and they can scan them in, and or even bring the device and check into the center. So there has to be some kind of a connection between home and the center, and that all this data, all this attendance, all this participation has to be documented and going back to the same backend portal. And that's how we can generate our monthly report. Getting more done at a lower cost, and I explained that already. There is a lot of saving from medical trips to transportation and things like that. And so that's definitely something that we should look into when we consider virtual programming. Beyond EMR, EHR, as I mentioned, virtual is very personal. Is there any language capability that go beyond English? Is there any is there any design that can really be so easy or so user friendly that can get your member to use it without any hesitation? And look into horizontal partnership. What I meant about that is that there are ways that we can look at down the road to continue to optimize our cost, our operation, without and be able to have extra resources to expand in other new markets. For example, we are talking about content. There are exercise, there are classes online that can be provided through virtual programming that may not be created by your center. However, those content can actually be broadcast, and all you need to do is you can actually subscribe to those content these days, and you can subscribe senior yoga class, you can subscribe senior arts and craft class. You can subscribe them and then have a facilitator to be able to be sitting into multiple virtual classrooms and then monitor your members interacting with each other. So now it becomes one activity coordinator able to manage multiple virtual rooms and will be able to interact with more members. So it's that kind of savings that can then allow you to perhaps put the human resources into other areas and to scale it up in maybe recruiting more new members, creating more newer programs for rural folks that can be joining your program from their home. So horizontal partnership is that to look beyond our traditional way of operations. Look at DoorDash, look at Lyft, look at other virtual things out there that can be integrated into your operation. And then maybe the next slide, please. Just some takeaways. So last but not least, what are we really looking at here is functionality, security. Looking at function not only one way, it's actually a triangular functionality. On one end, we're looking at members and users or end users interactivity, how to keep them interested and being engaged. And then on the other end, it's the staff, the caregivers. How are we going to make sure that our PACE task list on a daily basis will be delivered and not causing more workload for your team? Then the third end is going to be partners. How are we going to integrate them? How are we going to make sure that everybody is on the same platform, talking, chatting, messaging, sharing files, and really working for the good of your members? Then identify the outcomes that you want to achieve. When we are looking at virtual platforms, look at long-term, short-term. Long-term plan is really how to integrate all that stuff together. And then, a hybrid model. Not every single hybrid model will look the same. It really depends on your situations, but it will be in between, last year where you're at to a fully virtual world, and in between where you're going to draw the line. You may be 70% center, 30% virtual in the beginning, and then you can then slowly move it up, the proportion. But that idea of really putting that hybrid model in mind is very important, I believe, for the 2021 business plan. And then identify measures of success. How are we going to measure those KPIs? What are the KPIs? Is that engaging, right? What we do as best practice, actually, before my clients begin their virtual programming, we always do an entry survey. So we will be asking in a questionnaire their members, are you feeling isolated? Are you getting all the engagement that you need? Do you have people to talk to? And are you feeling lonely and things like that? How are you going to get your medical services right now? So we can do a simple survey, a 10-question survey. And then every single month, we measure that changes. So, in the first month, we'll do an exit survey and say, are you seeing this improvement? The same area, are you seeing more improvement? Are you happier? Are you having less depression and things like that? The second month, the third month. So we actually administer a 3-month over the period of time, measuring the impact of virtual programming, and that becomes our story for really upscaling it. If we want more funding to get to the next, full-blown stage of a hybrid, you'll need to have some traction. You will need to prove some data, some success, and so those surveys becoming very, very helpful. So that's pretty much it. This is my contact. You're welcome to contact me, and I believe that we can go to Q&A. Any questions? I'll be very happy to answer it. And we have a lucky draw, a raffle at the end of today's presentation. So it will be our JPad. Our JPad is a tablet, and that my company provide for our customers. And so we'll be able to see who's the lucky winner today for a little holiday gift. So yes, I welcome any questions, and perhaps Lynette can help me to do the draw at the end of the session.
Thank you, Rosita, for your presentation today. We really do appreciate it. Are there any questions for Rosita? If not, I am going to turn on my camera. And let's see. Nope, you can't see me. Can you see me, guys? I can't see me. I am going to draw a name out of a bowl. All right, let's see. Mix them up really good. And
can I ask a question while you're doing that?
Sure, go for it.
Definitely.
Yeah, this is Ava Smith in Wilmington, North Carolina. My question to you would be, would the JPad or the system perform some basic vital signs? Would we be able to monitor, say, for a heart rate or beat audio-wise with like a disc device on their chest or something to that effect?
Yes, so it is a great question, Ava. So yes, we actually integrate medical devices, not just vital, but also blood pressure, device and blood sugar, things like that. What we do is that we run on a Bluetooth, connectivity. So if the device that you choose can run on Bluetooth, the chances that yes, it can be integrated into our system. And Also, there's different ones like, Samsung and Apple or Google. They all have their health kit. And so basically what my JPAD does will be capturing those data. So the device will continue to run on its own way, but we will integrate the data being captured and then send it back to our backend portal, which we will give you the free login. And so you can look at, every single member and what is a vital sign today. It will be coming a monthly report or a weekly report. So yes, so our job, the virtual device is really, in that sense, in the perspective of a medical device, capturing, it's really for the data. And so yes, we will be able to have the data integrate into the JPAD or the tablet, and then send it back to the backend portal for you as the care team be able to look at it member by member. And that is a very important part. In fact, it may take, just because there are so many devices out there, and it can be any kind of device that wanted to be integrated. So we will ask for usually a couple of weeks that you will let us know what are the devices that you want to be integrated to or with. And then my engineers will start to kind of look into every single of them. So be prepared. There will be what we call the customization period of time, and usually it will go parallel with training. It's not just like, hey, you get the device, you sign up for the subscription, you have the software, and then we'll ship to you and here you go. It's never like this. In fact, that's just the beginning of a partnership. You will be telling us, we're going to do a very in-depth intake and looking at what are the devices, what are the medicine, how frequent, your members, will need to take, the medication, what are the transportation that they, usually do, things like that. So we kind of get a really good snapshot of your need assessment. And then we're going to look at our backend portal and our JPAD device and see, is there anything we need to support, this PACE community in terms of customization. So that takes about 2 weeks. And then simultaneously, we will have that 2 weeks for training. So your caregivers, we will do train the trainer. We don't prefer to train the members, but we will train the trainer or even train the family members and really get them to be so comfortable with all the devices and the backend portal for the 2 weeks. And we will do multiple training. And then the subscription will begin at the end of the training. And that will be, also wrapping up the customization in terms of the technology environment. That goes back to the point. It cannot be cookie cutter. It has to be health, and virtual is personal. It cannot be just one size fit all. And that's our philosophy.
Thank you, Rosita. Any other questions?
I'm just wondering how many of you here have been using virtual programming or telehealth already? I believe there's quite a sizable number that we are using telehealth at some form, some shape and form.
Innovate Virginia PACE in Roanoke Valley has been using Zoom for some of our telehealth meetings with our clients.
Mm-hmm. That's great. I mean, that's a good step.
We're using some telehealth to perform assessments, routine assessments, and then also a PERS unit, which is monitoring certain individuals for the vital signs with reporting weekly.
Mm-hmm.
Coming in.
And has it been quite receptive among your members to, Zoom is a little bit more, Zoom is multi-steps to get to those conferences, but in general, has it been quite easy, or what's the feedback from the care team? Are they thinking that could be the way to go in in moving forward to hybrid.
Well, it certainly is beneficial during the COVID pandemic to maintain some kind of contact with folks, and certainly visual is superior to just verbal.
Mm-hmm. Yeah, so we actually had gone through extra miles to, because of the some of the feedback that we had about members having some more difficulties of joining or finding the buttons, finding the links. We actually had created something called the auto join. So if you're doing wellness check, they don't need to have any links. It's just at certain time at 8 o'clock every morning, when it's time for wellness check, they will turn on the face-to-face video, so you at least can see if they're not doing well. You can see they look pale, they look fragile or something like that. So that's something that we have been hearing is the barrier of joining or participating, so there are things out there that can actually help make it easier for the face-to-face time.
So we have staff that our drivers will take the tablets out to our participants for when they have appointments or whenever we need to see them, and help them get it set up before leaving them with the tablet. And then we still sometimes have trouble with the participants not really understanding how the tablet works or being able to utilize it.
Yeah, and also, I mean, that's really a good point, because at the end of the day, you will need to have more staff doing those driving rounds and just to meet those appointments. And if the appointments become more frequent, right, then the staffing, the pressure on staffing will increase. That's why I'm thinking that, well, look into a system that actually can avoid those, that will avoid overloading the staff, and easy to join, and then make the infrastructure become integrated into all these multiple appointments and activity.
Okay, well, thank you guys again for the questions and Rosita for the presentation. I know we have 6 minutes left. Are there any other outstanding questions?
How is I'm actually curious to know, how is the connectivity? Is the connectivity like, do they usually have Wi-Fi, or you think that most of the members are going to need data plan or something like that? Because I heard that the CMS is considering covering Wi-Fi for Medicaid, and so that is something that I think for the interim before that kicks in, virtual programming will be looking at you have to have connectivity. Is that pretty common that your members will have Wi-Fi at home?
Most of our participants probably don't have Wi-Fi at home, but the tablets that we use have built-in, have the Wi-Fi built in or data. So that's how we're doing our telehealth visits with them right now. And sometimes it works great, and sometimes, depending on where they live, if it's a rural area, it's a little more difficult.
Mm-hmm. Great, yeah. So yeah, I think that's a way to go. That's definitely the way to go. I mean, there are tablets that are having built-in connectivity or optional, I mean, the coverage is really a tricky part, right? I was in a meeting in in New Hampshire, and I was told only Verizon there works. So yeah, so we with some folks who are more in remote areas, that could be a little bit tricky, but definitely find a tablet or the device had a built-in SIM card or a built-in data.
So comments from Joanne Turner from Pace at Home. She stated that they have used Zoom and FaceTime in limited ways. It's not easy because there is resistance from participants.
Yeah.
Their participants, I'm sorry, their participants will need data plans as most do not have Wi-Fi currently.
Yeah. That's a good point, and that's why I mean, in my system we don't use Zoom, or we actually have our own video conferencing built in, and there's zero barrier. You just show up, and that's with elderly, that's why we need to look at the product design and see if it really fit for elderly. A lot of them, they say they are, but actually still it's been challenging. I hear it over and over and over. FaceTime, I spent $400 to buy an iPhone XE for my mom, and she still cannot use the FaceTime. And so there are systems out there that is just super simple, 1 or 2 button, and that's it, and there's no barrier to join. So do our due diligence, and when you vet and select your system, do check them out and see if it's going to stay, right? If a system that you sign up today, it's going to be okay, well, COVID, everybody has to use it, but what about after COVID, right? And so we need to make it sustainable and user friendly.
Well, thank you, Rosita, again for your time today and your presentation. We are coming up on the 1 o'clock hour. I did draw earlier the name, Joanne Turner. You are the lucky winner of the JPad.
Yay!
Yay! So I will make sure that Rosita has your contact information, your email address, if that's okay with you. I will send that to her, connect you two, and y'all can figure out the logistics. Thank you to everyone who joined today. Have a great weekend and happy holidays, everyone.
Happy holidays. Thanks for joining.
Goodbye.
Bye-bye.